Hi, I'm Dr. Zimri and I'm a GP, and today we're going to talk about chronic idiopathic urticaria. So let's start the clock. Now, chronic idiopathic urticaria is basically where you get hives, and usually you get daily symptoms lasting more than 6 weeks, and we usually don't know the cause for it. It's just basically your immune system reacting weirdly. Now, if someone does present to GP or in a clinical setting with these symptoms, it's still worth investigating just to make sure there's no underlying secondary causes. Now, the investigations we typically do is a blood test and possibly urinalysis depending on our suspicions. Other conditions to think about is autoimmune diseases, and more rarely malignancy can also present with unexplained itching. Now, there is a blood test called RAST testing, but it's not considered accurate or useful in the diagnosis of chronic urticaria. It also carries a very high false positive rate, meaning that it can positively identify an allergen when it's actually not the case. So the non-pharmacological approaches are usually keeping the skin cool and being stress-free, as stress is associated with some flare-ups of hives. You should try and avoid any obvious physical or other triggers, and that's because there's different subtypes of chronic idiopathic urticaria, and these are a few. Now, although chronic spontaneous urticaria is not an allergic condition, if some patients are adamant that the diet is causing the allergies, then you can have a discussion about pseudo-allergens in diet. Now, in terms of medication, you can start a second-generation oral antihistamine, something like cetirizine or fexofenadine, to help control your symptoms. If those are not controlling your symptoms, though, after around 2 to 4 weeks, your doctor may prescribe off-license usage of an oral antihistamine up to 4 times its maximum dose. Now, for nighttime itching, which interferes with sleep, your GP may also add in something like chlorphenamine or another sedating oral antihistamine, something like hydroxyzine, which you can take at night. So if you are getting some hive-like reactions and you're unsure of the cause, then please see your local GP or local family doctor. And as always, I hope that helped.